Occlusion is the relations of the maxillary and mandibular teeth during functional contact. The term is used to describe this way teeth are aligned and fit together. In an ideal occlusion, all the maxillary teeth fit slightly over this mandibular teeth. The cups of the upper molar fit into the buccal grooves of the lower molar, and this midline is aligned. Few people have perfect occlusion and malocclusion. Abnormal positional relationship of the maxillary teeth with this mandibular teeth is a common reason of patient to seek orthodontic care. Although most occlusion do not require treatment, correcting and malocclusion can enhance the patient appearance and ability to clean their teeth or reduce the risk of developing oral disease.
Malocclusion is often hereditary. Its result when these upper and lower jaw are disproportionate in size. The size of the teeth is too large or small for this jaw, or the spacing eruptions of the teeth is abnormal. The following is a summary of the modified classification of occlusion first established by the orthodontic Edward Hartley Angle, who based his classification angle classification on this occlusion relationship of the permanent first molar.
Class 1 occlusion is considered to be the ideal normal occlusion and normal anteroposterior relationship of the jaw. In class 1 occlusion, these mesiobuccal cups of the permanent maxillary first molar occlude fits into the buccal grooves of the permanent mandibular first molar. Also, these maxillary canine occlude in this interproximal space between this mandibular canine and first premolar. Class 2 occlusion occurs when these maxillary teeth appear anterior to this normal relationship with this mandibular teeth. In class 2 occlusion, these mesiobuccal cups of the permanent maxillary first molar occlude mesial anterior to these buccal grooves of the permanent mandibular first molar. There are two divisions. Class 2 division 1 is when these maxillary teeth are protruded levoversion, producing a large overjet, and this maxillary first molar is anterior to normal relationship. Class 2 division 2 is where these maxillary central incisors are intruded linguoversions, producing a deep overbite, and this maxillary first molar is anterior to this normal relationship. Class 3 occlusion is where the mesiobuccal cups of the permanent maxillary first molar occludes distal posterior to this buccal groove of the permanent mandibular first molar. This is condition produce a prognathic profile. This lower project forward